40 Pulmonology PANCE Practice Questions, COPD Part 1. Hello, welcome to the Science Guide ASAP Learning. Today we are going to be practicing 40 PANCE Pulmonology COPD Practice Questions. Be sure to watch Part 2. Hope this helps. Please support this new channel by liking this video and subscribing for more videos like this one. Question 1. What is the most common cause of COPD? A. Smoking. B. Air pollution. C. Occupational exposure. D. Genetics. Answer. A. Smoking is the most common cause of COPD, accounting for approximately 80% of cases. Question 2. Which of the following is not a common symptom of COPD? A. Chronic cough. B. Shortness of breath. C. Chest pain. D. Wheezing. Answer. C. Chest pain is not a common symptom of COPD. Question 3. What is the gold standard test for diagnosing COPD? A. Chest X-ray. B. Spirometry. C. Arterial blood gas analysis. D. CT scan. Answer. B. Spirometry is the gold standard test for diagnosing COPD. Question 4. Which of the following is not a common medication used to treat COPD? A. Albuterol. B. Ipratropium. C. Montelukast. D. Tiotropium. Answer. C. Montelukast is not a common medication used to treat COPD. Question 5. What is the most common cause of acute exacerbations in COPD? A. Infection. B. Air pollution. C. Smoking. D. Exercise. Answer. A. Infection is the most common cause of acute exacerbations in COPD. Question 6. What is the target oxygen saturation range for patients with COPD? A. 88 to 92%. B. 92 to 96%. C. 96 to 100%. D. 100 to 104%. Answer. A. The target oxygen saturation range for patients with COPD is 88 to 92%. Question 7. Which of the following is not a common complication of COPD? A. Pulmonary hypertension. B. Cor pulmonale. C. Myocardial infarction. D. Pneumothorax. Answer. D. Pneumothorax is not a common complication of COPD. Question 8. Which of the following COPD medications is a long-acting beta agonist? LABA. A. Albuterol. B. Ipratropium. C. Tiotropium. D. Montelukast. Answer. C. Tiotropium is a long-acting beta agonist, LABA, medication used to treat COPD. Question 9. What is the most common type of COPD? A. Emphysema. B. Chronic bronchitis. C. Asthma. D. Bronchiectasis. Answer. B. Chronic bronchitis is the most common type of COPD. Question 10. Which of the following is not a common comorbidity associated with COPD? A. Cardiovascular disease. B. Osteoporosis. C. Depression. D. Renal failure. Answer. D. Renal failure is not a common comorbidity associated with COPD. Question 11. Which of the following is not a common cause of COPD exacerbations? A. Infection. B. Air pollution. C. Exercise. D. Medication non-compliance. Answer. C. Exercise is not a common cause of COPD exacerbations. Question 12. A patient with COPD is experiencing worsening shortness of breath, cough, and sputum production. What is the appropriate treatment for an acute exacerbation of COPD? A. Inhaled corticosteroids. B. Antibiotics. C. Supplemental oxygen. D. Long-acting bronchodilators. Answer. B. Antibiotics are the appropriate treatment for an acute exacerbation of COPD if there is evidence of bacterial infection. Question 13. What is the most common cause of death in patients with COPD? A. Respiratory failure. B. Cardiac arrest. C. Lung cancer. D. Pneumonia. Answer. A. Respiratory failure is the most common cause of death in patients with COPD. Question 14. Which of the following is a common complication of COPD? A. Pulmonary hypertension. B. Pleural effusion. C. Pulmonary embolism. D. Bronchiectasis. Answer. A. Pulmonary hypertension is a common complication of COPD, occurring in up to 50% of patients. Question 15. Which of the following is a long-acting bronchodilator used for maintenance treatment of COPD? A. Albuterol. B. Salmeterol. C. Montelukast. D. Ipratropium. Answer. B. Salmeterol is a long-acting bronchodilator used for maintenance treatment of COPD. Question 16. Which of the following medications is a long-acting beta-2 agonist commonly used in COPD management? A. Ipratropium. B. Montelukast. C. Salmeterol. D. Theophylline. Answer. C. Salmeterol is a long-acting beta-2 agonist commonly used in the management of COPD. Question 17. Which of the following diagnostic tests is considered the gold standard for diagnosing COPD? A. Chest X-ray. B. Pulmonary function tests, PFTs. C. Arterial blood gas, ABG, analysis. D. High-resolution computed tomography, HRCT. Answer. B. Pulmonary function tests, PFTs, are considered the gold standard for diagnosing COPD. Question 18. Which of the following COPD medications can cause a dry mouth and increased heart rate as side effects? A. Albuterol. B. Ipratropium. C. Salmeterol. D. Theophylline. Answer. B. Ipratropium can cause a dry mouth and increased heart rate as side effects. Question 19. Which of the following pulmonary function test results is consistent with a diagnosis of COPD? A. Forced vital capacity, FVC, of 5 lb. Forced expiratory volume in 1 second, FEV1, FVC ratio of 80%. C. FEV1 of 3.5 LD. FEV1, FVC ratio of 65%. Answer. D. An FEV1, FVC ratio of less than 70% is consistent with a diagnosis of COPD. Question 20. Which of the following is a common complication of COPD exacerbations? A. Hypercapnia. B. Hypoglycemia. C. Hypertension. D. Hyponatremia. Answer. A. Hypercapnia, or elevated carbon dioxide levels in the blood, is a common complication of COPD exacerbations. Hope this helps. Please support this new channel by liking this video and subscribing for more videos like this one. Be sure to watch part 2.